Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, 340B Report's publisher and CEO, and I'm joined today by Shannon Young and Will Newton, who are 340B Report associate editors and senior writers. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. Please be sure to subscribe today to take part in our December 15th webinar on HRSA's 340B rebate model pilot, which will be available exclusively to 340B Report subscribers. In the webinar, which will take place from 1 to 2 p.m. Eastern, our editorial team will provide an update on rebate litigation and other developments, and then Catherine Richardson of Second Sight Solutions will address pressing implementation questions and practical steps to prepare for the rebate pilot. You will not want to miss this timely event, considering that as of now, the rebate pilot is expected to begin on January 1st. Also, I want to encourage you to check out 340B Report's new business-focused podcast, 340B Leaders Up Front, hosted by Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. Today, we're going to focus on continued provider pushback to HRSA's 340B rebate pilot, including a new hospital lawsuit trying to block it altogether, a look at HRSA's recent webinar about the rebate pilot, new pricing details released on the next round of drugs selected for Medicare drug price negotiations in 2027, and finally, we'll discuss the Trump administration's final outpatient payment rule, which could have major implications for 340B hospitals and other stakeholders. Will, can you start by telling us about the new litigation challenging HRSA's rebate pilot?
Yeah, the American Hospital Association, along with the Maine Hospital Association and 4 major health systems across the country, filed a lawsuit against HHS, the Department of Health and Human Services, on December 1st, arguing that the rebate pilot was, quote, hastily made, ill-considered, and unlawful. And the same day that they filed that lawsuit, they also filed a motion for a temporary restraining order, which they're basically saying because the rebate pilot, as Ted said, is supposed to take effect on January 1st, they're asking the judge to just block it from taking effect while their litigation plays out. And interestingly, this lawsuit was filed in a federal district court in Maine. So in most of the other cases in the 340B space that we've covered and I've covered, when a stakeholder is suing HHS, they'll file their lawsuit in court in Washington, D.C., where the department's based. But, we have seen over the past year, especially when different groups are trying to challenge Trump administration policies, they've been increasingly turning to different courts throughout the country with the hope that they might get a more favorable outcome there. We can speculate that the hospitals might feel they have a stronger case of getting a positive outcome in Maine than they would in Washington, D.C., but we don't know for sure. And because the pilot's taking effect so soon, this is something we'll be very, very closely following, because anything the judge says will have a huge impact because, it starts in less than a month. Should also clarify that this lawsuit is completely separate from some other rebate-related litigation that we've been very closely following. And there is a separate case before a federal appeals court in Washington, D.C., that is challenging HHS's broader authority over rebates. Basically, can the Secretary of HHS decide whether or not there are rebates in the first place? And I know in our last podcast, we talked about oral arguments that happened mid November. The drug industry is arguing that they should be able to implement rebates without HRSA's prior approval. Another hospital group, 340B Health, is arguing that rebates are prohibited altogether. Government is arguing that it should be allowed to determine whether or not there are rebates, and the government's using that authority for the rebate pilot. So all that goes to say is that while the government is very much operating full speed ahead, covered entities, drug makers are as well, there is some pretty high stakes litigation that could impact whether or not this rebate pilot starts on January 1st as expected. And Shannon, I know the exact same day that American Hospital Association filed its lawsuit, a different major hospital group also took some action related to the rebate pilot, and you did some good reporting on that. Can you tell us more?
So also on December 1st, America's Essential Hospitals president and CEO Jennifer DeKubelis sent a letter to HRSA Administrator Thomas Angles requesting additional information on manufacturers' rebate plans, as well as a meeting. She also asked Angles to ensure HRSA conducts oversight on implementation and to extend the pilot program's initial 45-day window for claim submissions to 90 days. Now, HRSA has not publicly released the approved full rebate plans, even though most of the drug makers, except Novartis, which was the last one approved, have posted their implementation plan notices on Beacon. And Beacon Channel Management, of course, is the vendor that all of the drug makers taking part in the pilot have chosen to administer their rebate plans. So again, right now we've got 8 of the 9 drug makers have published their notices, which detail parts of their plans, but not the full nitty-gritty details here that AEH and other covered entities have been asking for. DeKubelis argued in her letter that while AEH raised, quote, significant concerns about the rebate pilot in a previous September letter, many of those concerns, quote, remain unaddressed despite the rapidly approaching start of the pilot. She also asked Angles to meet with AEH at his earliest convenience to discuss these concerns and to mitigate confusion among covered entities that are participating in the pilot program.
Speaking of the rebate pilot, there were some major technical issues with a highly anticipated webinar that HRSA hosted on the rebate pilot yesterday. We're recording this on Friday morning, and we had quite a day yesterday. Will, can you tell us more about perhaps what happened there and what you were able to glean from the parts of the webinar that you were been able to listen to so far?
Yeah, it was definitely quite a day. It was honestly a whole mess. But basically, the backstory is that on Monday, December 1st, HRSA sent out an email to people signed up for an email subscription list saying that it was going to host a webinar on its 340B rebate pilot on Thursday, December 4th. This is a pretty big deal because this would have been, and this was one of the first times that HRSA officials had publicly spoken about this pilot since announcing drug maker approvals. And so there's a lot of anticipation for it. We ran an article about it, and a lot of people were reaching out to us asking, how we found this out. And we were like, we got this email from HRSA, but HRSA, for whatever reason, didn't publish a press release basically saying the same thing anywhere online. So it was, if you got the email, you knew about it. If you didn't, you didn't, unless you were a subscriber. And so there's this big buildup for it. And then finally on Thursday, when the webinar started, the link that HRSA put in its email that we publicized on our website wasn't working. And so we were kind of bombarded with emails and calls from different stakeholders asking if we were able to access it, what the problem with the link was, et cetera. And we finally figured out that there was basically just some extra code in the email. So if you delete the first part, you could get it to work. So I did that, got onto the webinar, watched the second half of it. And then later that day, HRSA sent out an apology email saying, we know there are some technical issues and we're going to post the whole thing later. And so that will be available to anyone. But anyway, that's kind of the backstory. And as for the actual webinar, my main takeaway was that it was fairly scripted. I know that when I've covered HRSA officials speaking at conferences, when Shannon and Ted have done the same, they're often kind of caged in what they can say. They're very deliberate. They're very much sticking to the script. And that was very much the case with this. In many ways, it sort of seemed like rehashing a lot of the guidance that HRSA had already put out about the rebate pilot in PowerPoint form. Although one thing that was pretty interesting was HRSA mentioned that Apexis, the 340B prime vendor, would have a tool available soon for covered entities to report denied rebates to the Office of Pharmacy Affairs. And so that's pretty interesting, because I think one of the biggest questions we've heard and concerns we've heard from covered entities is what happens when we submit claims and a rebate is denied and we think it should not have been denied. And there were some concerns that, okay, if we appeal it through the drug industry vendor, are they going to be very friendly to us? And the final escalation is to go to HRSA, and this Apexis tool will be the way to go to HRSA. And so we will be reporting on the full webinar and any other interesting tidbits that come from that once it becomes available. But yeah, it was a bit of a mess, and we're, especially with everything else going on and everyone so at the edge of their seats about the implementation, it was for sure an interesting day.
Sure. Well, I would say, considering that it was only a 15-minute webinar, and they did not take any questions, and may have been pre-recorded, it may not have been answered all the questions everyone has. I guess it underscores the importance of our upcoming webinar on December 15th, where we'll get an hour with Catherine Richardson, who works for Beacon Channel Management. She's actually with Second Sight Solutions, which also owns 340B ESP. And so we encourage you all to, if you're not currently a subscriber, to become a subscriber, so you'll get to be able to get your questions answered during that webinar. So thank you. With that, we'll take a moment to hear from one of our great sponsors, and then we'll be back.
Struggling with your 340B TPA? PharmaForce delivers unmatched claims visibility, reporting capabilities, and configuration control. With our 97% customer retention rate, it's clear why leading covered entities trust our solutions. From 340B grantees to academic medical centers, we're setting a new standard for 340B management. The switch is easier than you think. Visit thepharmaforce.com to get started. PharmaForce. Finally, 340B your way.
After months of negotiations, the Trump administration also recently released the maximum fair price it will pay for 15 high-cost Medicare Part D drugs starting in 2027. Shannon, you reported on this. What can you tell us about what they released?
Yeah, so on November 25th, CMS released the maximum fair price, or MFPs, that the federal government will pay for the next round of drugs selected for Medicare drug price negotiations under the Inflation Reduction Act, also known as the IRA. The MFPs for these 15 drugs would go into effect on January 1st, 2027, so still a bit away. But 340B experts have cautioned that the negotiated prices for certain formulations of those medications may still be higher than their 340B ceiling prices. And this is noteworthy because under the IRA, drug makers must offer covered entities the lower of the MFP or the 340B ceiling price, but not both. Specifically, one source who looked at the numbers here told us that based on current national drug code pricing data, 36 of the 89 active NDC formulations for the 15 selected drugs, or about 41%, appear to have 340B ceiling prices below the MFPs. And about a third of the selected drugs NDCs have a margin, or the difference between the MFP and 340B price, of more than $100 per package. The source didn't specify which of the drug products have NDCs with MFPs higher than 340B price, And 340B ceiling prices are not publicly available, and they can change each quarter based on a drug's average manufacturing price from the previous quarter. So again, a lot of this is kind of speculative from our part, but this is what we're hearing from sources who are able to see this data and these numbers. And then, some concerns here. Jason Reddish, a principal at the law firm Powers, Piles, Sutter, and Verville, which represents 340B providers, noted that the drugs selected for the 2027 IRA Medicare drug price negotiations included primary health drugs that FQHCs in particularly frequently prescribe. And so he said the loss of meaningful 340B savings on those drugs will be very painful for them, especially if HRSA does not end the rebate pilot. So there's definitely concerns there on what this could mean for 340B covered entities if there's, discrepancy in these prices here.
Well, that's really interesting, Shannon. And I know that those concerns are shared with hospitals as well and others in the 340B community that also buy these drug products. You also wrote about concerns that the hospitals have raised over the Trump administration's final outpatient payment rule, which recently came out. What can you tell us about that? No longer proposal, but now requirement.
Yeah, so in late December, CMS also announced it had finalized the 2026 Hospital Outpatient Prospective Payment System rule, which we refer to as OPPS, and the Ambulatory Surgical Center rule. It included a Medicare drugs acquisition cost survey and a plan to accelerate outpatient payment cuts to offset previous 340B hospital lump sum repayments, but on a delayed basis. So under the final rule, CMS would increase OPPS cuts from about 0.5% to 2% annually, while reducing the clawback period used to offset a court-required reimbursement from 16 years to 6, though unlike the July draft rule, that would begin in 2027 and not in 2026. So that's a little bit of a delay there. Hospital advocates lauded CMS for delaying the implementation of the July draft rules plan, but they argued its eventual pursuit of an accelerated 340B remedy recoupment is both, quote, bad policy and unlawful. They also took issue with the final rule for including the Medicare drug acquisition cost survey, something which they've argued could be a precursor for another Trump administration attempt to significantly cut Medicare Part B reimbursement to 340B hospitals. And Ted, this is an issue I know we've all been following for years now. Can you give us a little bit of background and history here as to why that's so significant?
Yeah, it seems like deja vu all over again here. We're back to 2018 when the Trump administration first tried to significantly cut reimbursement, Medicare Part B reimbursement to 340B DSH hospitals. That eventually was overturned by the U.S. Supreme Court in a 9-0 decision. I think the Trump administration believes that the reason the court decided against the administration is that they felt like they didn't go through the proper steps in implementing the cuts, which includes a requirement for a robust survey. So I know that the hospitals are quite concerned about another crack at the apple and are concerned that this survey it will likely show that they're getting these drug products at a significant discount. And that's, they would argue, is really the point of the 340B program, is to be able to bring in revenue in order to offset the loss of providing care to low income, uninsured and underinsured patients. And this would just be basically subsidizing the Medicare program, when in fact the purpose of 340B was to allow covered entities to stretch scarce resources and expand care. So this is going to be a really important issue. The hospitals argue, how could you do this to us at the same time that you are reducing Medicaid reimbursement overall to covered entities by $1 trillion over the next 10 years. So it's what we would describe as a double whammy. And so there's real concern here about the administration and why they're trying to do this again. And it will be interesting to see. I would not be shocked at all if we see further litigation in an attempt to block implementation of potentially even of the survey. So stay tuned. As you know, we've all become really good court reporters, reporting various cases throughout the world, and we'll continue to keep an eye on the federal courts in every state. So I think with that, we're going to call it a day. I do want to say that I encourage you all to keep an eye on everything that's going on related to 340B. With 340B report, we will have a full story on the webinar that occurred. As soon as we get the full recording, we'll be writing a story about it. In the meantime, Will, you did a nice job summarizing the 8 minutes of the 15-minute webinar that you were able to listen to yesterday. And of course, keep up on everything that goes on by looking at our website, which is 340breport.com, or our twice weekly newsletters. And finally, just a friendly reminder, if you're not currently a subscriber, you can take advantage of our 25% discount for first-time subscribers only by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thank you for joining us, and we look forward to talking to you before the holiday.